everyone. Happy to answer some questions. I would just start by saying, of course, Manitobans understand that we are in some very significant moments right now with continued escalating numbers in hospitalizations, continued high case counts on a daily basis. In the words of our Chief Provincial Public Health Officer, as he said earlier today, we are at a crossroads where the things that we do starting today really matter. So I would say, and I believe we've been clear, that when it comes to the things we should be doing, that return to fundamentals of washing of hands, social distancing, staying home when you're sick, we've got 98% of Manitobans doing the right thing, and we say thank you to those Manitobans. And for the 2% that aren't there yet, we say now is the time. It's enough messing around. We need that broad compliance by every Manitoban to be able to arrest these increasing numbers right now. It is truly up to all of us to do so. I would add, just before I take questions, we are pleased to continue to see the increase to resources that we need in the system. Manitobans saw another screening site come online just this weekend at 125 King Edward Avenue. We are pleased to know that there are over 200 tests per day added to our system just at that one location. We know that there are other testing sites coming online in South Winnipeg on the University of Manitoba campus. There are sites articulated for Dauphin and for Winkler and other MPI sites in Portage-la Prairie. So we continue to build that capacity. There was a case backlog that we became aware of. I reported on this, or I informed media of this last week. I am pleased to say that the work continues and has been significant to eliminate that backlog. That is good to know. And also when it comes to the contact tracing, that in many ways right now is the cornerstone of our efforts, we're pleased to be able to report that at this time we do have that Red Cross resource that has been added in. We also have that Stats Canada resource. We have people that are hitting the ground running, or hitting the desk in this case, and assisting to do those important efforts when it comes to contact tracing, case investigation, and daily follow-up. And when this is fully flexed up, we believe that those additional capacities will add as much as 25 to 50% to our capacity. So we continue to build the system that we need. We continue to add the resources that we need, but these numbers continue to be very concerning, and now is the moment for Manitobans to shine and to show that they are willing and able and ready to do the right things.
Minister Friesen, we have numerous doctors speaking out saying that they can't control what's happening in ICUs right now, and they're calling for more restrictions or a full lockdown. What's your response to that?
I read the letter from doctors that was co-signed by a number of doctors. Doctors are concerned. They are concerned for their working conditions. They're concerned for their patients. They're concerned, as all Manitobans are. We share their concerns. I would note that in areas they spoke to, like screening site capacity, we are making those changes to add capacity. They speak about the need for rapid testing. I can tell you I spoke yesterday to the Federal Minister of Health and indicated that Manitoba needs differential access on a timely basis to exactly those machines that doctors are talking about. Doctors spoke about other needs for human resource to be added, and we're doing that. Hiring, redeploying from within. Doctors talked about the need for the focus to be on the safety of Manitobans and not right now on the bottom line. We agree. We will add up the invoices later, but I would want all Manitobans to understand that the full focus of this work is to get the right things, procure the right tools, hire the right people. That's where our focus lies. But I think that the greatest point of agreement that I have with those doctors is when they write that we are at a critical juncture right now, and that Manitobans all must take care right now to reduce their contacts, to stay home, and help do their part to avoid spreading the virus. And on that point, we are clearly aligned.
Are we on the brink now? You said we were last week.
Pardon me?
Are we on the brink of their health crisis?
I think what Manitobans want to understand is this: as they see the hospitalization numbers rising, as they see that there are more people in ICU than there were last week, they want to know, is there a plan? Is there a plan that is able to reorient our healthcare system to address the challenge that it is facing, or the challenges that it's facing? My answer to that is there's absolutely that plan. There's that plan that is being led by health system experts that are working hard, that worked all weekend to understand what resource deployment looks like. I am advocating for a technical briefing, I believe, to give media even a better glimpse into what those plans entail. I think it's important. I think that our Chief Nursing Officer, Lynette Saragusa, did an excellent job last Friday of providing the broad strokes of how the system would respond, but there's more clearly, I believe, that can be conveyed, and so we will be looking to set that up. Manitobans want to know there's a plan. There is a plan in place. Consider this, just today, you heard this update provided, that as we will continue at this point in time through our medical experts and our system leaders to postpone non-essential surgeries and procedures, then we have that opportunity to take that resource and redeploy it. Here are some helpful numbers for you. We have 1,700 people in this province involved in delivery of surgery. We have 700 students at the University of Manitoba Rady Faculty of Medicine. These are resources that we could redeploy. We have other people within the system that we could redeploy to help with this effort. So while people see that we are approaching capacity, the good news is that we have the ability to flex this capacity, and this is exactly what our plan is.
We hear more stories every day about some of the tragedies that are happening at the personal care homes. The opposition keeps pushing for the province to take over, or for the military to come in and take over some of these places like Parkview Place and the Maples, I think. Why is the government resistant to do that? What are you guys doing instead that you are seeing effective in combating some of these issues as opposed to taking over altogether?
So let's be clear that this same opposition called today for people to be entering personal care homes right across the province with clipboards in hand in order to do inspections. And this is in direct contravention to what public health is saying would be safe. So that would be reckless behavior, and we will not do that. But at the same time, we will do more inspections this year of long-term care centers than was done previously. We put a lot of thought into this. Our experts and our leaders in this area proposed a plan that would see virtual inspections, which we believe will bring a very good overview of the system. We had this same leader of the opposition less than a week ago say it was time to empty out certain long-term care facilities and then to reassign residents in other personal care homes. This is not recommended by any public health expert. When it comes to the issue of who is running our long-term care centers in Manitoba, Manitobans understand that we have a broad array of service delivery organizations, a broad array of providers. Some are faith-based, some are right within the regional health authorities, some are non-profit entities. We have this array of providers that are under one of the best inspections and oversight mechanisms of the entire country. We have faith in these provinces. We will continue to have faith in them. But clearly, as we go forward, we've always said nothing is off the table. We need to know, and Manitobans need to know, that those individuals and those groups who deliver care to our residents in long-term care facilities are doing everything they can to keep their residents safe.
What about the Red Cross or military? What about the Red Cross or military?
I had a meeting yesterday with Minister Patty Haydu of the federal government, Minister of Health. I spoke to Minister Haydu about the Red Cross. Now, remember, we've had one conversation in respect of marshalling resources from the Red Cross for the purposes of bolstering screening, or I should say, for bolstering public health contact tracing, and that's ongoing. I also explored with Minister Haydu the issue of Red Cross, whether there would be a resource available to come into Manitoba and to be able to additionally assist us should we have additional issues in long-term care homes. I've said before, we are hoping for the best in all things, but planning for every contingency. So those discussions are being explored. I can go further and tell you that I believe at this point in time, the ask has been made, formally written to the federal government to say, What can the Red Cross provide in terms of resource? I also asked Minister Haydo to know whether there would be any advantage in, as you say, bringing the military into jurisdiction at any point. It wouldn't be the point we are at now, but if at any point there would be that ability to bring specific medical capacity in the area of ICU. And at this point in time, those discussions remain in place. There is some investigation. The minister did express that in the cases of Quebec and Ontario, that was challenging to do. It was challenging to deploy that resource. So we will continue to look in every place for the capacity that we know we need, but we will also continue to express faith in those whose responsibility it is to lead that overall charge on making our system ready. I want to just reflect one more time on that letter from doctors. Doctors want to know also that there is a plan. I have instructed Shared Health to be sharing often and well with doctors about what the plan is. I understand that on the weekend, system leaders had some very considerable engagements with doctors, that there is now in place a daily update to all critical care doctors, and that tonight I believe those efforts will continue to engage with senior leadership and specialty leads across the system. So how we communicate does matter, and we need to right now communicate well. If I can play a role in that, I will as well. So I'm also calling a meeting with doctors to make sure that if I have the opportunity to provide additional comfort to them about how this system is being arranged, I will play that role.
Thanks, everyone.